enter the room.
Hello, sir. My name is Vikram. I'm one of the junior doctors here. Before we continue, can you just confirm for me your name and date of birth, please?
Yeah, I'm James Clark and I'm 53 years old, doctor.
Okay, good to meet you, James. I have your biopsy results, okay, from your endoscopy. Is it okay if we discuss them?
Yes, doctor, I'm quite eager to know what's there in my biopsy report.
Okay, I appreciate that. And then before we continue, can you just briefly remind me why you had the biopsy done? What was the surgeon's reason for that?
Yes, doctor. So 5 years back, I went to my GP with this problem that I have this regurgitation symptoms, and I just regurgitate food out, and I have this bad chest pain at times because of this. And I think my GP started me on omeprazole, and I've been taking it for 5 years, and I don't see any improvement. So I think that's the reason to get this endoscopy done.
Okay, I see. And then you just had the biopsy done a few weeks ago, and I have the results here. And then before we talk about that, did you have any concerns or ideas for today's meeting that you want to go
Yes,
over?
doctor. I just want to, know what's happening with me and why is this not getting done with, and why there's no improvement. And it's quite difficult for me to sleep with this. It's getting disturbed. So I just want you to give me something, stronger for this other than this omeprazole. I just want to know what's happening.
Okay, I see. And then before we talk about it, do you have any ideas what it might be or any concerns that you feel we need to address?
I'm not sure what's causing all this, doctor. I just wanted to know my biopsy reports. Maybe it can give me an idea.
Okay, yeah, and you mentioned your omeprazole is not really working for you. You still have trouble keeping things down. It's hard to sleep at night. I'm sorry to hear that. What were your expectations after today's meeting? Would you like us to adjust the dose or give you a different medication, like in your own
Yeah,
words?
yeah, I think I just want something stronger for this GERD. I don't think omeprazole is going to help me out, so I just want something better.
Okay, I have your results right here. Would you like to discuss
Mhm.
them now?
Yeah, sure, doctor.
Okay, so I have your biopsy results, and
Hmm.
according to this, you have metaplasia of the lower third of the esophagus for about 5 centimeters, and then there's no dysplasia or neoplasia. And then I know I just threw a lot of words at you, medical
Yeah, I
terminology.
just couldn't
I,
get what you're telling to me.
yeah, would you like me to explain what that means?
Yes, doctor, I'm quite scared with all these big words thrown at me.
No, it's okay. We get that a lot. So metaplasia. So normally the lower part of your esophagus is lined with like flat types of cells
Hmm.
that keep everything moving down for motility. And then metaplasia, some of those cells are starting to change because you've had GERD for a while now. Like all that acid coming back up, it's like a big stress on your body, on the cells and the tissue lining your esophagus. So we're seeing some changes right there, and I'm not too concerned about it right now.
Hmm.
Neoplasia, that's just in layman's terms, means cancer or tumor growth, which you don't have right now, but we do want to keep an eye on that because metaplasia does have a risk of turning into cancer. But if caught early, we can't treat it. Like you said, we could adjust your medications, we could talk to surgery, we could talk to GI, try to figure out a plan that works best for you.
Okay, so what does this mean? Does it mean that will I get cancer and should I be worried about it?
It is a concern, but at the time being, we're not seeing signs of it. But that's why we want to keep an eye on you. So what we recommend is you get regular endoscopies. We check your esophagus and get biopsies and tissue results every 3 years. We want to monitor that. We are probably going to want to adjust your dose. We can talk to GI about recommendations and take it from there and decide what works best for you to both keep food down, keep you healthy and active so you don't have these problems where you're struggling to keep food down, where you're having these problems to sleep at night, but also we want to keep an eye on this, like biopsy results, like make sure it doesn't progress and if try to reverse it if possible.
Oh my God, doctor, I'm not comfortable with endoscopy. The last time was quite uncomfortable. They just put this big tube inside my mouth, and it was the most uncomfortable thing that I've ever been through. So I'm not okay with these endoscopies every 3 years once. Is there any alternative to it?
Endoscopy is the recommended method, and I can understand discomfort, yeah, shoving a tube down your throat. Are there any other concerns you might have about that? Have you talked to your surgeon about these concerns? Like, he could probably better address that than I can.
Yeah, I haven't talked to him about it yet, but after I went through it, it was, quite uncomfortable, and I do not like it. So yeah, I'm just telling you that I'm not comfortable with endoscopies.
Okay, I'm sure like we can work with a surgery team to figure out what works best for you, but we do want to keep an eye on
Hmm.
that. Like, and then is it okay if I take a quick look at you now?
Yeah, sure.
Okay, so at this point, I do the GI exam, and then I probably just check the oropharynx. I check for lumps and bumps around the neck. I ask them why do they like check for erosions in the back of the mouth, and then ask them, okay, so I've just examined you, thank you. Now, I don't see any problems jumping out at me. And then, like you said, endoscopy can be uncomfortable for a lot of people. And then I understand you might be concerned about these biopsy results, but
2 minutes remaining.
let's work together with the surgery team and the medical team, find out what works best for you in terms of monitoring, and then in terms of adjusting your medications, and then hopefully find a plan that works. Does that sound good?
Okay, that sounds good, doctor. So what can I do right now to get, better from this? What can I do to keep this foot down and just not come up all the time?
Okay, well, you mentioned your omeprazole is not really working and you're taking 20 milligrams, that's correct?
Yes, that's right.
Okay, well, how about your diet? Like you were able to handle your diet before the GERD, or have you changed your diet recently?
No, doctor, I just eat pizzas and fast food. I'm a pizza delivery guy, so I just go with it.
I see. Okay. Well, we can't talk about diet. It's not something anyone can change overnight. Maybe add a few veggies, some cleaner, healthier options to that diet as well, and then maybe we can up the dose of your omeprazole and then check back and see how that's working.
Yeah, maybe we can try it out.
Okay, that sounds good. So we can like talk together about diet. We can talk about adjusting your medication, and then we'll follow up and see any changes or improvements, and then we'll go from there.
Okay, I think that sounds good. And will all this just help me be comfortable and, not wake me up at night and, that gets really disturbing. So will all this, changing the food habits and getting these endoscopies done make me feel better now?
Everyone responds differently to our intervention, so
Hmm.
I can't say for sure like it will help, but we
Hmm.
can see what happens and try to aim for that improvement and then adjust as needed. Correct?
Okay, I think that sounds good. So do I need to keep a follow-up and do I need to check my how I'm doing then and there? Or what about that, doctor?
Yes, I would recommend you see me again and also get endoscopies, but we can talk about that at a later date.
Yeah, I think
Move
that
on to the
sounds
next
good.
station.
Thank you, doctor.
No problem. Okay,
Yeah, that was a good consultation.
thank you. No, I was feeling a little nervous towards the end because I was preparing for like I was going to take a medical history, like someone said something, I narrow it down like the Socrates, but yeah, now I
Mhm.
have to like try to say results and like what's going on with you? What do you think this might be? I saw that briefly, but I wasn't prepared for this, so I was a bit nervous. But I know I made a few mistakes probably, but like if this was the real thing, would you say I passed?
Yeah, so there's our examiner who's going to give you a full, complete detail of it. But from my point of view, you just went really well. You didn't show that you was nervous. You just carried out the thing well. But there are a few things, in the history taking that we need to concentrate on. And there's something time management that we need to see about it. But I think you did really well. So yeah,
Yeah,
you
I know
can be
like the
quite
time.
confident.
Thank you. Yeah,
Yeah.
no, like the time management, that was the big issue for me. So my
Yeah.
exam is on February 7th of next year. And
Mm-hmm.
then I've just been like, after PLAB 1 ended, I've just been like reading some of these scripts, reading some of these differentials, and then just practicing with like a stopwatch. And then I've been trying to,
Okay.
so far I've been getting it to like 8 minutes or 10 seconds, 8 minutes, 20 seconds. So right now I'm like in the practice phase, like the rehearsal phase.
It's a good thing that you took up this mock in the early stages, right? So you can just streamline your how you study and how you do your consultations. It's going to be of a big help to you. So as you are in your starting stage, it's very easy to rectify these problems, and I think you'll be a pro when you come in, January, February. So yeah, you can just be confident. And I'll be passing it over to our examiner, who'll give you a very detailed feedback. Is that okay?
Yes, thank you. I appreciate it.
Yeah, thank you.
Hello, Dr. Vikram. Nice to meet you again. Well, it
Nice to
was a
meet you too.
very good scenario, very good discussion. So let's start by from the beginning. So I would like to tell you that whenever you enter the or start the scenario, you first need to approach the examiner and you need to tell the examiner about your GMC number and who you are. Okay, so when the bell rings, you need to go inside and say like, "Hello, I'm Dr. Vikram, GMC number 12345. May I proceed?" Okay, so that thing is also included in your 8-minute time. So you need
Oh,
to
okay.
start the scenario. Okay, so you need to start the scenario by saying these lines. After that, you approach the patient really well. Okay, you established a rapport, you greeted the patient, and you also asked his name and his age. Well, the thing is that I would like to point out is that whenever you approach the patient, always confirm the full name and ask the name preference as well. Like in case it was James Clark, so it would be really good that if you ask the patient like how would they be like to be called? Okay, so would they prefer James or would they prefer Clark or whatever? After that, you were given in your patient's notes, oh sorry, your notes that the patient has already been diagnosed with GERD and had an endoscopy and a biopsy. Okay, so I feel that your data gathering was really lacking. Okay, you lack a lot in the data gathering. Well, what data gathering means, like in the patient history, when did they develop good? How did it develop? What did they do for it? Why did they get the biopsy? How was the endoscopy? How did they fell? Okay, has anyone explained the result to them? And duration and severity of the symptoms. Actually, these were the things that the patient told you, but in real life, when you get in the lab exam, these are the questions you need to ask to the simulator because every time the simulator is not that nice as it was in this case. Okay, they will not give you such straightforward answers. They will like twist you. So you need to know what questions to ask so that you can get a right straightforward answer. As you know that in your notes, it was given that the patient was taking omeprazole. So you should have asked like, how is your compliance with it? So have you been taking it regularly? And another thing, there is a mnemonic called P-meftosa. Have you ever heard of it?
PMed what?
Meftosa.
No, I haven't heard
This
of
is
that one yet. I've heard of Socrates though.
okay. Okay. Well, Meftosa, is a mnemonic which you use after doing the Socrates, okay, or Ordipara. It stands for medical history, you know, uh, medical history, medication history, allergies, family history, travel history, occupational history, social history, and associations. So this is a systemic way, and you need to go step by step, okay, in which you need to ask about the patient that whether they have any other medical conditions. It could be like they might have any other condition which can be associated with GERD. So you need to ask that as well. Any other medication they are taking apart from omeprazole, any allergies, and what do they do? Like in this case, the patient was a pizza delivery guy. So if you have asked these questions, you could have easily asked about the diet as well, like they eat junk food, okay? And pizza delivery guy also have some irregular working hours. They sleep late at night, and the patient also told you that they have symptoms mostly on night, which shows that the severity of the symptoms has, increased in the past few weeks. So you need to address all of this. In social history, you need to also ask about exercise, smoking, alcohol, because smoking and alcohol also contributes to GERD. And in this case, the patient has been smoking for like 20 years and drinking alcohol a lot more than the threshold level. Are you following me? Are you getting my point?
Yes. No, I assume like that's like if you do. I thought this was an established patient, like they already know they have GERD. This was like a follow up. If this was like the first time seeing this, I would have like probably done all that stuff.
Well, yeah, well, that it's a valid question, but the thing is, the patient doesn't know that the smoking or alcohol contributes to his or her symptoms. And and when the patient asks like what should they do to control these symptoms, even the omeprazole is not controlling it. So if you have already asked about the lifestyle habits, you could have counted the managing part really well then. Like you could have counseled the patient to reduce smoking, reduce alcohol, eat a healthy lifestyle. Even in the examination section, there was written like BMI was 28. So it was like, in the upper limit. So you could have also addressed that you need to exercise, you need to sleep well. So these are the things that you need to, focus on. Apart from data gathering, let's move to management part. Your managing part was really good. Okay, you explained the endoscopy results really well. You also explained that there was a endoscopy need for every 3 years, and you also reviewed the medication. But the thing that I would like to point out is that, and one more thing, the patient asked you, like told you that the previous endoscopy was really uncomfortable. You can say that I'm sorry that that you experienced in the previous time, but in this time we will we will try our best to make it comfortable. We will inform our consultant surgeons, and they will take extra care of you. You don't just refer the patient like you don't know anything how to make it comfortable. It's your responsibility. Patient has come to you, so you need to. It was a counseling station, so you need to counsel the patient that you don't need to worry about it. Okay, we are here to help you. You understand that it was a very uncomfortable. Endoscopies can get uncomfortable, many times, but we will try our best to keep it comfortable because it is really necessary for us to do. We need to, early diagnose the condition and early treat it. And also considering that your exam is on February and you took a mock session right now, so you now know a bit about PLAB as well, like how to approach it, how many steps are there you need to follow. So it's a really good practice that you have come here. We will love for you to come back again for another mock.
Thank you. I appreciate
So
it.
one thing in management, you also need to tell about like there's a time issue in counseling stations because there's a lot of talking. You need to talk and you need to get the responses of the patient right, and you need to also acknowledge the all the emotions. So time issue is there, but you also need to mention about the safety netting and the leaflets about Barrett esophagus. Okay, like what can be the complications? You will provide them with the pamphlets considering all the information because it's a, which can secure you marks, extra marks.
Are there gonna be pamphlets in the room? Like, all this stuff is gonna be like in that simulated room, like to like use and stuff like that.
No, you just need to verbalize it. Like you can
Uh,
say that, you can just say that, okay, James, before we end this discussion, I would like to give you a pamphlet considering all this information, and I would wish you a good recovery, speedy recovery. That's it.
okay.
So your data gathering was, a lacking, and management was okay. Your interpersonal skills were good. Okay, you respected the patient's choice and decisions. You allowed the patient to ask questions and express concerns. You showed sympathy for patient symptoms as well. So considering this scenario, your interpersonal skills, I gave you 3 out of 4. Okay, your IPS was good. Your management was okay, but you lagged in data gathering. So I gave you a total of 6. So I think that you have barely passed this. But if you could improve data gathering, then it would be a really, really great scenario. Data gathering doesn't only include Socrates, it's also include PMFTOSA. Anything that comes before the management is actually data gathering. And then, management starts. So examination is kind of part of data gathering as well. And one more thing, in examination, you also need to mention about the vitals, like you will check the pulse rate, blood pressure, respiratory rate in all of the cases. Okay, like this is the routine in United Kingdom in England. So whenever you say that now I will have a look at you, it means that you will be checking these things: respiratory rate, blood pressure, heart rate, and you need to mention these as well.
So a couple of things like since you mentioned that you did not practice any counseling station, so this is a good way to start off. In fact, your consultation was pretty good, and you managed to cover all the important aspects of conducting a case. I think you might have got an idea of how to conduct cases from practicing the symptomatics. But like you mentioned, in the counseling station, you already have a diagnosis. But what you're trying to understand is how that diagnosis came about. So you need to understand the patient's lifestyle and the risk factors that actually caused, him to get GERD and Barrett's esophagus. So there might be some underlying causes that you need to rule out. You need to understand the situation at that point.
Yeah, and never assume that anything that is not given in the candidate info, that is very important. So like you assume that it is a follow up where you already know things about the patient, do not assume that unless it is specifically given in the candidate information. So for example, in this, there's nothing about what caused him to get GERD and how he is managing with it, or what led to him being diagnosed with GERD. So all that you need to gather for yourself, because that is something that they'll definitely look at, where you're not allowed to make up information that is not given in the candidate information. You have to gather that from the patient.
Think of it like your first day in the NHS. So if you're meeting this patient and this is the first time you're meeting, and you know it's a follow-up, she knows it's a follow-up, but then you don't know anything about the patient apart from what is written in the chart, and that's the candidate information, whatever is written in the chart. So you have to understand the patient situation so that you can counsel them about how to live with this condition and give them the right kind of advice and a realistic plan. Right? So that's why you're trying to look at it in a holistic way. You're trying to understand the lifestyle and the risk factors, and if it has developed into any complications like any dysphagia or any weight loss, is it, how badly is this condition affecting them? Because you have in your hand a diagnosis which you know is Barrett's esophagus. Now you need to understand how this Barrett's esophagus is affecting this person's life and accordingly give a personalized plan. Right? So majorly in this case, Barrett's esophagus is a precancerous condition, as we know, but since there wasn't any dysplasia, it wasn't precancerous just yet. But there was metaplasia, and that was very well explained on how the flat cells become columnar and because of the acid reflux. But not just acid reflux is one of the risk factors. It could also be smoking. So that is something that you could have picked up on, why this has happened. And the other clue that you could have, mentioned in the findings, you see the BMI is high. So sometimes you will get such clues on, why this happened. These are the hidden clues that you will get in the consultation that you have to uncover by asking the right questions and doing the right examinations. So the risk factors for Barrett's esophagus is alcohol, smoking, lifestyle like food, diet, and high BMI. So those are the things that you need to investigate whether or not this patient has, and accordingly give them the the treatment plan. That follow this for a while, and you will see improvement. When she said that, will I be okay with this? It's like this is a process where you and I have to work together, and you will need to follow a treatment plan that we are charting out for you, and we can see how well it improves. It does take time because you're trying to give them a realistic idea of how to live with this, because you as a doctor know what this is and they have no clue. They don't even know why this has happened, what are the aspects of their lives that they need to change, right?
Yeah, that makes sense.
Yeah, awesome. And the other thing is that if something like so the other thing that you need to understand is you have to, if you see the task, you are required to tell them about the follow-up, the recommendation. So you have to tell them to come back for an endoscopy, and so they will have a lot of resistance towards that. So you need to understand what are the resistance that they have towards endoscopy. So since you already know that they've undergone this procedure, ask them how that went, so that if there are particular resistance that you can pick up on, you can give management plan personalized to that as well. Like you can ask you can tell them that this time we can actually give you a proper diet plan. If you reduce smoking and alcohol consumption, maybe it might get more comfortable. We can adjust the dose of your omeprazole, trying to reduce the GERD symptoms. If she's sleeping, there could we can look into the posture of how you sleep so that the regurgitation is relatively less.
And you can also try to mention some things, even though you don't have any control over how the biopsy will be done, endoscopy and biopsy will be done. You can give them an assurance. So it's not over promising, saying that they'll try to be as comfortable as possible, and whatever discomfort you had the last time, we will make sure that we mention that to them, and then they can do something like give you an anesthetic, or think about doing it under general anesthesia. So there's always options, right? You should always give them a way that you shouldn't make them feel like, oh, you are doomed, you don't you don't have an option, you have to do this.
Or making them do the extra work of them going and talking to the surgeons, because it will be more promising to get an answer if you as a doctor is talking to another doctor rather than asking the patient to do that. So like I can definitely talk to the team and see what we can do, or I can send a referral letter to your surgeons to understand how they can help you with this procedure the next time they're doing it, right? And document it, because you want them to do the procedure. You don't want them to be averse by the idea of doing another endoscopy, because that's the main thing, right? You have to monitor whether or not it's getting cancerous, because the first the life cycle of the cell has changed, because now it's almost towards the end of its life, like there's going to be cell death soon. So before that happens, you need to monitor that all the agents that are causing it to change is kind of you're restricting it. So that's what you need to tell them. The monitoring is very important, because this is a precancerous, this can lead to a precancerous condition which has a very high risk of leading to a cancerous condition, right? So the monitoring is the main thing that you have to sell them on. So you have to tell them that we will try to do everything in our from our side to make sure you're comfortable.
Okay, now that makes sense. Yeah, it's just like getting all of that under 8 minutes.
Exactly. So you need to understand what are the important aspects of this case to actually uncover, because this is a counseling case. You have a diagnosis. You need to understand how bad the diagnosis and the requirement of the task. That is, talk to the patient, explain the results, discuss the management, and inform the patient about the endoscopy. So you need to sell them on that you have to do endoscopy, and we will try to make it as comfortable from our side.
Because so you also need to make sure that the patient understands. At the end, you need to ask them, are they, because you really didn't know whether she is actually going to go for the endoscopy at the end of the consultation, if you realize. Because once the patient leaves your consultation room, you don't know what's going to happen to them. And at this point, that's the main thing that they're looking at, the examiners, to see that are you a safe doctor. That's their main objective in the entire exam. So whether every time you see a patient, always think about what's the worst thing that can happen to this patient. So if you keep that in your mind at the back of your head, that helps you a lot in most of the points. In data gathering, you can ask for red flags if you keep that at the back of your head. And in management, you can give safety netting, like what are the warning signs that I need to tell them to look out for, and when you need to set up a follow-up, and these are very important. So we tell everyone that at the 2-minute bell, just make sure you these three things come to your mind, that is safety netting, follow-up, and leaflets and pamphlets. These three carry 1 mark each, like if not more. So if you cover these three, you'll definitely get at least 3 or 4 out of 4 in management, because these 3 points will give you a structure for the entire management, if you think about it. Because you're telling them what current issue is, the management is, that's not the end, that's not all of it. So you need to see what happens after the patient leaves, and by giving leaflets, you're telling that you're agreeing that there's not enough time, so you can't tell everything. So you have to give some reading material, otherwise they'll go away with half information, right? That's why leaflets and pamphlets are very important. It's enforced in the NHS that you have to give them to the patient, so you have to make sure that you mention that as well.
Safety netting, what was that again? Like, can you give me an example?
One of the complications of this condition can be, it can become into cancer, or it can cause dysphagia, right? So you've already, either you ask the red flags like that, or else you can give a safety netting saying that if at all you feel like you can't eat food anymore, or you're losing weight drastically, please inform us. Or if you see any blood that is coming out of your mouth, please do come to the emergency immediately. So that is like you're telling them that these are the complications, so look out for that. And if you see that this has happened, do seek medical advice immediately. So that's what you're trying to tell. So every time when you have a condition, think about the worst things that can happen to it. So either ask for the red flags to see whether it has already happened, or give it as a safety netting, saying that if this happens, please do come back or seek medical advice as soon as possible, right? And this you
Okay,
also,
that makes sense.
yeah, and this also you can try to say that I have some reading information for you. This would also help you. Contains information about the signs that you need to look out for. If you have any of these signs, please make sure that you seek medical attention immediately, right? So that's another way of doing that. That way you got two points in one sentence.
No, thank you. I appreciate it. Like, this was super helpful. And then, if I wanted to get a subscription, I can do it on the website.
Absolutely, yes. Or you can, if you have any.
Yeah, I'll actually send you a detailed feedback of this mock session itself, and then
Yeah.
I'll tell you how you can purchase. We have different plans available for doctors who take the mock test. I'll send you those over.
No, I appreciate it. Thank you for meeting me today.
Thank you,
Right,
Dr.
thank you.
Vikram. This was a lot of fun.
Yeah.
And good luck with your preparation. If you have any questions or any doubts, if you want to ask anything, you can reach out to us personally, or else you can drop a message in the group, which would be very helpful for the rest of the people who are there in the group as well.
I appreciate it. Thank you so much.
All
Okay.
right. Bye bye.
All right, see ya. Bye.
Thank you, Doctor.
You too. Enjoy the rest of your day.
Please like and subscribe to Turing Med School. Good luck with your preparation.